Hi, everyone. Welcome to Center for Conscious Kids on our Conscious Living podcast series. We have done it. A whole year has gone by in Center for Conscious Kids, and this is the beginning, first day of our second year. And I'm so excited. Our guest today is visiting us on Facebook Messenger live in the San Diego studio at Specially Produced Network, Dr. Cherie Smith, chiropractor,
Hi.
amazing healer. Hi, Cheri. Welcome.
Hi.
We're so glad you're here today. We wanted
Thank
to
you.
talk about your work. You have just relocated to Colorado, and your
Yep.
business is called We Got Your Back Lifestyle
That's
Chiropractic.
that's right.
And we wanted to talk about creating support throughout your whole entire child's life. And so what does that mean, Dr. Cheri? When you see women who are getting ready to think about being pregnant, what would you share with them as probably some of the biggest things that they can do from a chiropractic standpoint to to have the most optimal pregnancy they can?
Yeah, that's a huge one,
I
right?
know.
That's really important. That's a big topic, but really simply, getting pregnant is kind of like training for a marathon. You really want to make sure that your system is really clean, that you have maybe done some cleanses to clean out toxins from your system. One of the most important things for carrying the baby is pelvic stability. If you have a nice, strong, healthy pelvis, that's not just a pelvis that's not in pain, but that's a pelvis that is really strong and stable and able to do all kinds of weight bearing activity. If you have a nice, strong, healthy pelvis, it's really easy to get through that pregnancy with great communication to the baby and great baby position in the uterus. If
Yeah.
there's any pelvic instability at all, it can create a lot of torsion in the uterus and abnormal nerve and blood flow to the tissues. So that's not something that feels really great while you're pregnant. So those are two easy things to do. Just clean your system out, make sure your nutrition is really on point, and then make sure that your healthy pelvis is stable and ready to carry, 50 extra pounds of weight.
Totally true. Oh my gosh. I mean, I can just share my personal story. When I was pregnant 20 years ago, I didn't realize it. I had a little one. She was 5'3" when she was born. But around 28 weeks, my pelvis got very, very unstable, and I could feel my pelvic bones kind of separate from the right hip to the left hip, and it was actually tragically
Right,
hard to
right.
walk. And I couldn't walk.
Yeah,
I
that's
went,
really common. Yeah.
yeah, and they put me on crutches. I even went on crutches, and the orthopedic surgeon said, "Well, we can't help you until you deliver." And I'm like, "Well, I think when I deliver, the problem might be a little better." So, and
Yeah, we don't notice because when you're pregnant, you get a lot of ligament laxity from the hormones. And so, if we don't have that nice, stable pelvis to begin with, then that ligament laxity can create lots of havoc in the spreading of the pelvic bones. And that just feels really terrible.
yeah, I literally I was fretting, crawling to the bathroom. It was incredible, and
Right, right.
and I'm
Yeah.
like, I don't know
I don't envy you.
how do you
That's
do
for
that?
sure.
And so a friend of mine, I was in Hawaii at the time in Honolulu, and she said, "Go see a chiropractor." And I said, "Well, I've got to because I can't
I
can't
can't
believe I'm
walk.
on crutches while I'm pregnant. This is crazy." So,
Yeah.
so I went to a chiropractor, and 3 visits later, I walked out without the crutches, and I could walk
Yeah.
with much, much
It's
more.
another chiropractic miracle. It
Yes,
happens every day in chiropractic. It really does. It's kind of a special thing. So,
yeah,
um,
it really is. And so, and that's really, really awesome. And so, as the mom does get larger, and the baby gets larger, and we have more fluid, and the whole abdominal area is really taking up that area of the pregnancy. What happens to the back and the spine where you can really support moms? Because moms may think that they don't need to see a chiropractor because they can't lie on the table or something like that. How can they still be seen and be supported?
Yeah, so I have a table that actually breaks away and accommodates for the baby and the belly, which is pretty awesome. So when you lie down on your tummy, the table opens up and it makes space for that tummy. But many chiropractors don't have a table like that, and they can still do side posture adjusting, seated adjusting, and supine or lying on your back adjusting, which is just as effective. As a matter of fact, a lot of the work that I do is through the belly and through the hip flexors and trying to get the lumbar spine to open up and the pelvis to reposition from the front. So you really don't even need to lie down on your tummy to be adjusted at all. It just feels really good.
Yeah.
So women come in and just want to lie down on the table for 20 minutes before we even get started because it feels so great to be able to lie down on your tummy while you're pregnant.
Right. Right. Exactly. And then just sharing with you as the baby gets older and then the birthing process happens. And when do you like to see the infant after they're born? When is the best time to come in? And what kind of
Yeah,
adjustments would you do with young newborn babies?
yeah, that's such a great question. I really tell people as soon as you can see me, come in. As soon as it makes sense to leave the house or put the baby in the car, come. If the baby has problems, like anything significant, like feeding problems, problems with digestion, elimination, anything where you can't get to me, then that's when we do house call and just show up, make sure the baby can, latch, nurse, swallow. All of those problems are really common for people to struggle through, and it doesn't have to be so much of a struggle. If you can get that baby adjusted right away, their latch is better, their nursing is better, they're more comfortable. And so as soon as you can get them adjusted is the best. The reason why I think the most important part is that being born is really dynamic. I don't care if you have a really gentle, amazing home birth or you had a really powerful, dynamic hospital birth with lots of intervention. Both of those are dynamic and both of those have the potential to create some stress in the baby's body. Adjustments on infants are super delicate, they're very gentle, and the babies aren't stuck in a funky pattern. So they usually release that stress and heal really quickly. So the adjustments are very gentle, very quick and easy, and it just helps the nervous system turn on and relieve any mechanical, neurological, or structural stress that the baby endured while they were being born. That includes C-sections. Most people think C-section is not stressful for the baby, but it's actually more stressful in some ways. The baby's head doesn't get to compress and then expand as it goes through a normal vaginal delivery. There are problems with which baby part they grab to pull the baby out. And so the babies can have just as many stressful problems from a cesarean section birth. So as soon as possible is the best thing. And then the chiropractor that you see, I always tell people, your baby's doing great or your baby needs more intervention, and then we get a care plan based on how the baby's doing.
Yeah. And kind of what they present with.
What they
But
present with, yeah.
yeah.
Some babies have a lot of torsion and a lot of plagiocephaly, which is the bent head. Like it's kind of common for babies to come out and they look a little crooked and their heads are a little squished. But all of that normal plagiocephaly should balance out within the first 24 hours after delivery. Any weird head structural stuff that doesn't balance out after the first 24 hours is really a sign that there's some stress in the nervous system and stress in the cranial bones. So those are easy things to fix when they're new and still really malleable.
Yeah. Well, and speaking about that too, like a lot of times in myself working inside the hospital in a newborn intensive care unit in different areas, I've seen a lot of babies that come out and due to whatever was happening, a cord around the neck or the delivery
Right. Yeah, that's
process
a common one. Yeah.
or they were at risk and the medical team had to get in there really fast and pull them out really fast and then do
Yeah,
medical.
it's dynamic, right?
Yeah,
It's a lot happening.
and but seeing them, which is common, is situations called torticollis or Erb's palsy or Bell's palsy.
Right,
All of
right.
those cranial nerves and neck nerves and the back of their head is really impacted through the birthing process. And
Right.
how does a chiropractor go to support an infant that way in helping relieve some of that nerve compression or that distortion that they experienced?
Yeah, so the adjustments are, again, really gentle with babies. We just maybe hold and traction the head, go through the spine segment by segment and see if there are any places where the spinal segments feel misaligned and just gentle traction to open up those joints and open up that nerve flow. There are usually misalignments in the way the skull sits on top of the spine. And so when we just traction and hold the baby's skull, or maybe hold the baby's skull with the pelvis and let the baby unwind that tension on its own.
Yeah.
Again, when the newer they are, the easier those things are to fix, because they're not used to adapting to being in a gravitational field. So used to floating in water, so their bodies heal very quickly. The longer they have those things, the harder it is to fix, but it's still much easier to fix it when they're little than it is to wait until we're 30 or 40 or 50, like most of us, before we got our first adjustment, you know.
Exactly.
So, but those are gentle things. And then for some more serious cases with the cranial deformation, we actually go inside the mouth with gentle pressure with a glove, and release tension in the cranial bones and open up the brainstem and the nerves that exit the base of the skull using those cranial adjustments. They're really powerful, but really gentle. So
Yes, I've had them myself. They are very gentle, and the amount of movement, even though the movement's only in a couple of millimeters, is profound.
it's profound. It has a profound effect on nerve pressure and nerve firing, how the brainstem fires.
Yeah, the brain fog
That
goes
brings
away.
yeah, not just for, you know, the structural misalignment that we can see, or maybe an arm that doesn't seem to work properly, but it also affects their digestive system, their ability to swallow, to latch, like we talked about, the
Yeah.
ability to digest food. Those are connected to a lot of reflux problems that babies have. When babies have reflux, they don't need an antacid. They need an adjustment. It's super simple. It just turns on their nervous system and allows their body to digest and assimilate the food that they're getting, especially when they're getting really clean breast milk. If they're not subluxated and they still have reflux, it's usually because they're having a food sensitivity to something in the formula. So then we go through all the different formulas and try to figure out if a baby does need formula,
Yeah, and even
how
food
to get
sensitivities.
a formula that's not sensitive.
Yeah, and even food sensitivities in the mom. A lot of people I'll work with,
Exactly.
the mom will be allergic, and then the baby's allergic the same, or the baby's
Yes.
allergic and the mom never was. And so a lot of
Right,
times
right, right.
we
Or,
I ask the mom, "What's your favorite food?" And they'll say
yeah,
something, and
that's
I'll
the
say,
one.
"Well, let's clear that one."
Yeah, it's
Because
usually that
baby's
one.
not eating. We'll work on what baby chooses when baby starts eating their own food
Right,
that way.
right.
Yeah.
Yeah,
That
yeah.
that's awesome. So colic, reflux,
Yep.
digestive problems,
Constipation, you
constipation.
know, we have actually a lot of pediatricians that tell moms and dads that it's okay for their baby not to have a bowel movement for a week or 2 weeks, and that's totally not true.
It's
It's
totally not
really
true.
important for babies especially best breastfed babies. That food should come in and go out, and they should have bowel movements every time they eat, minimally every single day. It's not okay for your baby to not be going to the bathroom.
Yeah.
It's not like they're just using all the nutrition and they don't need to
Right.
have any
There's
excrement.
right.
They still need to have a bowel movement. So bowel movements are really common ones too, the constipation part.
Right.
So those are all things that are
Well, and
regulated by the nervous system. And so when we have symptoms with organs that are regulated by the nervous system, the first place we look is there a problem with the nervous system? And the adjustments help to improve that connection so that the baby's body can turn on and start doing that on its own.
well, and even speaking about that too, how do you find that in newborns or our young infants or infants under 12 months? Does it happen the same as like adults or bigger people, like their ileocecal valve or other valves throughout their intestines get kind of stuck, or
Yeah, again, those are all regulated by the nervous system. So if we have neurological interference with that ability of normal peristalsis or normal signaling with the valves to open and close, then that can create lots of problems. It's a little bit different in adults because we also have emotional stressors that trigger those things,
yeah,
and not just physical or not just food. You know, babies are a lot cleaner. Not that babies can't have emotional stress too, but it's more common to have that in adults,
I see.
so then we have other issues that we have to clear when the adults get adjusted for that. So
Yeah.
um, yeah.
Well, and then speaking about like young toddlers and beginning preschoolers, what do you see mostly with them where where it would alert a mom that chiropractic care would be super helpful?
Oh God, yeah. It's really simple. It's this simple. If your child has a symptom that's not normal, any symptom, I don't care what it is, a tippy toe walker, mood swings, emotional stuff, um, clumsiness, dyspraxia, where they can't hold a pen properly or can't write, motor coordination, problems reading, problems learning. Any of those things are really, truly chiropractic cases because they're usually brain-based. So when we adjust the nervous system, we adjust the spine, we're stimulating how the brain controls the body. We're balancing out how the two nervous systems and the autonomic system, those two parasympathetic and sympathetic nervous systems work. So that includes digestive problems or immune system problems, like the kids that get sick all the time. Also, kids that never get sick. Sometimes kids that never, ever express any type of cold or anything like that, runny nose, sometimes it's because their immune system is not actually turned on enough to process something out. So yeah, but any symptom at all is potentially a chiropractic case. And chiropractors are all trained in pediatric adjusting. Some have more schooling than others, but everybody's trained in pediatric adjusting. It's really important to at least have your child checked and let that chiropractor tell you, oh, your kid's doing great, or your kid has a problem. Most scoliosis cases, even though we screen for scoliosis in junior high when the kids are going through puberty, that's when scoliosis usually get really bad. But most scoliosis started years before that, and we can see the signs of those beginnings of scoliosis before that even starts, and fix that and cure it before it progresses to something that's very detrimental to the human.
Right. Exactly. Because, all of us would agree that going to spinal fusions and other very aggressive surgeries
Yeah,
is not something we
right.
want to do for our teen that wants to live
Yeah,
for another, 6 or 7 or 8 or 9 decades more. So,
right. The most important thing I think about chiropractic is that it should really be used as a way to really stay healthy, keep your body functioning really well, and not wait for something to be wrong for years or decades before we start to notice devastating symptoms that are much more difficult to fix, right? You don't want to wait until you have a disease process to try and cure the disease. You want to keep
right.
your body healthy and functioning before that even starts. We don't wait until we have cavities or dentures to start brushing our teeth, right? Like we do that right away. As soon as we get the teeth,
Exactly.
we teach the kids how to brush them. So those are important concepts. But really for kids, like if you could only adjust one group of people on the earth, it would be children, because children heal really fast. They're so dynamic, and it really helps them achieve their true potential instead of just making excuses for why we don't have full potential. So
Exactly.
adjustments are so easy at that. I mean, it's such a great thing.
Well, and then also you're also connecting them with that body part or that pattern. So let's say they were a toe tipper and they were walking that wasn't typical, then
Right,
you're not only adjusting the neurological imbalances, but then you're also following up with them about how their gait or their walking is, how they're running,
right,
how they're interacting, how
right.
they're playing, how they're bending, all of those things that are connected. And not only is the child then connecting to how to work their body better, but also the parent is looking at, oh, that's a symptom or that's a sign or that's something that we can take care of. Like
Yeah, it's something
most
that's begging for an intervention, right?
Yes. Whereas many, many, many people may on the outside give the parents advice, oh no, they'll grow out of it. Or it'll get
Right.
better over time. It'll get better over
Pediatricians
time.
always say that. I think what pediatricians really mean is that eventually the child will stop coming to them because they get old enough. So they think that they are fine, but they
Right.
didn't actually outgrow anything. Maybe the body
Right.
got better at coping or masking the symptom or the imbalance. And the other thing is, pain is not a really great thing to wait for to see if somebody needs to be adjusted or if somebody's nervous system is in trouble, because only 4 to 6% of all the nerves in our body sense pain. We can have lots of things that are dysfunctional or less than normal or optimal function, and it'll never generate a pain response. So we think we're fine,
Absolutely.
So, but
Especially
if
our
your kid
gut, I
starts doing
think.
that when they're learning to crawl and they're doing that little crab crawl where they hike one leg but the other one doesn't really move, well, that means that their pelvis isn't in alignment, or their brain's not firing normal motor firing patterns into the cross crawl network of how to move an arm and an opposite leg, right? So those are, again, either brain based or structural, that a chiropractor can adjust and fix before that baby has to learn how to walk crooked its whole life.
Right. And then uncrook it when you're older. Like
When
we
you're older, after you have 10 years of back pain that you can't figure out or whatever.
Yeah,
So
exactly.
simple.
And then moving through middle childhood and where the child is growing big enough and they're really starting to work their body and they're starting to participate with sports. How does chiropractic care really help and enhance and bring out sports performance?
Yeah, that's such a great question. And it does it on lots of different levels. And I think we kind of touched on a few of them because we're improving structural and mechanical movement of joints and hips and pelvis and legs and knees and all of those things. We're improving motor firing patterns. So when you want hip extension, you get hip extension. You don't get body rotation to mask in abnormal hip
I
extension,
know.
right? So
I'm
those are
pretty
things
good at
that
that
help
one.
you, like, yeah, jump higher, run faster. I always tell little kids, you're going to get taller, you're going to run faster, you're going to jump higher. And they get adjusted and then they get off the table and run to test it out, make sure they're quicker. And they always feel faster after the adjustment. So that's really great. but,
Yeah.
um, but yeah, the other thing is brain integration and helping the brain and body be like on the same page. And we talked about that a little bit with cross crawl patterning and things like that. So but when we use our bodies properly, they always treat us well, right? It's only when we start using joints improperly that they start to break down or wear out. Like the other thing that happens with kids now is that they overtrain, and that's kind of a big one because we used to play one game a week and have a 1 hour practice, and now kids have practice every day and they've got 4 games on the weekends, and it's like too much, so. I mean, if you're a parent of kids that want to be active in sports, it's really important to make sure that they're not overtraining one sport, and doing too much like that, not allowing their bodies to have recovery. And nutrition is a huge thing. We always counsel the kids on eating proper nutrition and having a really balanced diet, having enough fat and enough protein in their diet, and trying to keep the sugars. Kids love sugar. Sugar's a big one. Trying to keep those sugars down to a minimum, especially the processed stuffs. So whole food sugar is so much better. But all those things. So hopefully your chiropractor will be counseling kids on healthy nutrition. I
Oh
always ask the kids,
gosh.
what does food turn into when you eat it? And they always say poo. But it turns into other stuff first, and then it comes out as poo.
Yes, exactly. It's energy.
It's
Yeah,
energy.
it's
Yeah.
that's so amazing. And so many people may not know that getting an adjustment too would also show, let's say a child, which I deal with, a highly sensitive child, so they may feel sensitive in their body and they may learn abnormal patterning of how to work with their body. And you can pick
Right.
up on that right away so that if they do start playing baseball or soccer or anything and they're running funny or they're pitching the ball funny or whatever it is that's out of alignment for their body, you can catch it early, get a good assessment of their functional
Yep.
work in their body, and then intervene. And so they can learn right away how to work with their body in a really high performance way.
Exactly.
Yeah.
And that's one of the most fundamental things. I think most parents are really afraid that their kids are going to be drawn into things that are not so healthy. And being adjusted really teaches them how to heal their bodies in a natural way without the use of chemicals and without the use of suppression. It really helps them express and move through what they're experiencing, without drugs and without medications that make them feel like their body's not good enough. Right? We're
Right.
like, when we do an adjustment, it's all about helping the body express its true potential of being strong and being healthy all by itself. That's what the body does. The body fixes itself. It self-regulates itself. It's making all the hormones that we need in the perfect balance at every moment, unless there's something wrong with that neurological connection. So,
Well, and speaking about that, for teenagers, especially girls, but also boys, through the preteen and puberty years, how does chiropractic help with that, with those emotional and hormonal balance? How does that support them?
yeah, it's so tremendous. And most young kids really love to get adjusted. The biggest problem, I think, is hormonal shifting, right? And when hormones shift in a balanced way, we don't notice so much. But when they rage, then that's where we start to notice more extreme symptoms. Not just from an emotional standpoint, but also from a physiological standpoint. We could see things like, poor complexion and things like that from hormonal things or from dietary things. But one of the biggest things that we do with chiropractic is try to balance out how the parasympathetic and the sympathetic nervous systems work together. So the sympathetic nervous system, most people are familiar with, that's our fight or flight response. And most people that have a teenage child understand that kid is kind of locked in fight or flight most of the time. They have a lot of emotional stress. They have a ton of social stress. Their bodies are changing so quickly, and it's really overwhelming for them. So with the adjustments, we try to really stimulate the parasympathetic parts of the nervous system, predominantly in the neck and in the low back and pelvis, to really calm down the stress response in the body and improve normal hormone balance, fewer hormonal surges, right? If we can have like mellow puberty instead of raging puberty, then those are things that just make the child feel a
I
lot more
think
comfortable in
everybody'd
their
vote.
bodies.
Yeah, everybody'd vote for that.
Everybody votes for that.
And
Right?
I
Same thing
think
with
feeding the
menopause and andropause. I
yeah,
mean, it happens as older adults as well. So
yeah,
same thing.
absolutely. And that parasympathetic is the nervous system that feeds most of the vital organs. Instead,
Right. And that's
and
also responsible for digestion and immune system function, sleep. And if you look at the things that most people have problems with, it's digestion, immune system function, hormone balance, and sleep.
right,
So,
right.
so getting adjusted is a really important part of balancing out that nervous system and allowing the nervous system to really have a chance to go into a relaxed healing state while we sleep, and better hormone balance and better immune system function. Not to mention you jump higher and run faster, which is also good.
Well, and sharing with us too. So, as you see a child through the time of pre-pregnancy or planning to be pregnant, all the way through fetal development and childhood development, when this child uh, moves away or changes, but so at the end of their childhood, and you have the parents there and the child there, what do you see happens in that young adult from receiving chiropractic care their whole childhood, not only from the parents' perspective, but from their child's perspective as they grew? What do you see about that? What do you, what like lights up your day and tells you this was really worth it that they saw me through their time?
I really love it. The first thing is when they find a chiropractor, where they go. Like, I love that. Like, their first thing is, help me find a chiropractor where I'm going, because that means that it was a really important part of their lives.
Yeah,
But I just think that kids that get adjusted regularly, again, we kind of touched on this before, but they just have a lot more body confidence. They have a
yeah,
lot more understanding of how the body works and how the body heals. They're not as likely to do substance abuse and try to mask or suppress those uncomfortable feelings or painful feelings in their bodies. They seek health and they seek nutrition on their own, which is just such a fabulous gift.
yes.
I mean, we all kind of want to not have bad things happen. And it's obviously not magic, but when kids are given choices and options that make sense to them, it's such an easier life. It's such an easier way to achieve happiness, I think.
That is so true. That is so true. Oh gosh, Dr. Cherie, thank you so much for sharing with us today of living with chiropractic care through the span of a child's life. And it's just so exciting and so much healing and opportunity for health and their own self healing is there.
Yeah,
And
it's awesome, right?
it really is.
It's so simple. Just turn on the nervous system and the body will do what it's supposed to do. It's really simple concept. So
Yeah.
don't be afraid. It's chiropractic is awesome, and kids fight to get on the table. If they're siblings, they tackle each other to get adjusted,
Yeah.
because they're still so connected to their bodies, and they understand. Even though they don't understand what you're doing, they understand how it feels in their bodies, and kids love getting adjusted. It's awesome.
Absolutely. Well, thank you so much for joining us today, and we look forward to you visiting again. And please feel free to share anytime on this Facebook page and on Center for Conscious Kids any new ideas, innovations, and processes that you'd love parents and families to know about.
Great. Thank you so much.
Thank you. Have a great day, everyone.